My name is Kwabna Chenchen, but into our very first story this hour, and in the Keta municipality of the Volta region, a whole community with over 500 residents has been submerged as a result of the rising sea level. The Pokpokbo community, which represented one of several polling stations in the municipality, is now virtually wiped off the map of Ghana. Now, this has left many displaced. Joseph Opoku-Gakpo visited the area for our latest hotline documentary, Climate Refugees. Here is an excerpt of that very documentary, which airs later tonight at 6:30 p.m.
This is where Pokpokbo community is located as far back as 2002. There's a satellite imagery showing the Pokpokbo community. Then in 2010, the community is now detached. Community is now detached.
So all of those other land areas have been submerged, and this is what is left of it?
Yes, so this is what is left of the community. Okay, and because the community is detached, it is now, allowing, or the system is now, or the situation is such that erosion has increased in that area. And then in 2013, look at what is remaining of the Pokpokbo community. This is what is left there, showing that a lot has happened between this short period.
All this place, the whole land from here to Pokpokbo, you can see opposite over there. Because formerly it was a whole lot you can walk from Puvame to Pokpokbo, but right now the sea has washed away of the land and you cannot move from Puvame to Pokpokbo unless you take a boat to cross over there. This thing started year 2003. The sea has started washing this portion of the land. I can see this place over here, there's a hotel over here, but all submerged into the sea.
One other community on the brink of extinction is Fuvame. Fuvame used to share boundary with Pokpokbo until the latter was submerged.
This is Fuvame. Now, this is a satellite image of Fuvame in 2013. Now, what you see here is a school in Fuvame. And this is the distance, or this was the distance of the school from the shoreline in 2013. Now, just last Saturday on the 6th of February, we went back to Fuvame, and then we took a drone, we flew a drone to take pictures there. This is the same school in Fuvame, but now look at the distance of the school from the shoreline. It tells you that the school is now, or the sea has moved very close to the school.
At this rate, in the next 3 years, if care is not taken, the school itself may be submerged.
Absolutely, because we are looking at 3-year interval. This is 2013 and this is 2016. So 2013, 2016, look at the level of destruction that has occurred in Fuvame. Now again, if you look at this area, we used to have a lot of buildings here. But then where are these buildings now? If you look at 2016, all these buildings are now in the sea.
Okay, so where those buildings used to be have all been taken over by the sea, and
Absolutely.
Now the buildings they've virtually been submerged.
They've been submerged. So the buildings are gone. People in those buildings are now displaced. And it's now a huge problem there.
And looking at it, more like 20, 30 houses there that most likely were affected by this. Just looking at the pictures and images.
Yes, just looking at the pictures, you could see that we've lost a lot of buildings here. And somebody I met last Saturday told me he lost his 5-bedroom house here.
Over the last 30 years, the sea has expanded by about 400 meters into this community, swallowing more than 150 homes. In the latest incident last February, 30 houses were submerged after violent tides battered the community.
That night, the town is very, very floody. You can see with your naked eye. The sea carry every people. The sea enter every people's house. They have destroyed so many houses within 3 days. A lot of people are deep asleep before the thing happens in the night. So when the thing happens, before the people realize that so many properties have been destroyed, the fishermen nets have been carried away by the sea. Some boats have also been carried away. The women too, there are poultries, that's chickens, ducks, and so on, are also carried away by the sea. The houses are far away in the sea over there. So many houses are far away. About 100 houses, if I'm not mistaken, about 100 houses are far away over there. So the one left here are just few.
Well, away from that, the Ministry of Health says it has released an amount of 1.5 million Ghana cedis to 3 psychiatric hospitals in the country. The release comes as the Accra Psychiatric Hospital says it has been compelled to halt new admissions of patients over debts the hospital owes its food supplies. Joining us, Maxwell Awogba has more in the following report.
The hospital has been in the news for weeks over a 4.2 million Ghana cedi debt it owed its food and medical suppliers. The inadequate food and medical supply pose danger to staff of the hospital as they do not have enough to cater for the inmates. And member of the hospital's communication team, Emmanuel Fibri, says the premier psychiatric hospital has been running on donations. He indicated the 1.6 million Ghana cedis the Ministry of Health promised the hospital is yet to hit the accounts.
Just as you've rightly put it, we were here when the Honorable Minister came around with his team and went on and gave us those assurances that looking at the impact the financial situation actually having on us, he's going to ensure that they work things out immediately, so we'll get some funds running. But we're hoping, as he said, immediately they will bring the money to us. And it's over a week now that we've not gotten the money yet.
In a sharp rebuttal, however, the Ministry of Health says it has disbursed an amount of 1.5 million Ghana cedis to 3 psychiatric hospitals in the country. This was revealed by the Public Relations Officer of the Ministry, Tony Goodman.
I'm aware we've sent 1.5 million actually to the Mental Health Authority to be sent to the psychiatric hospitals across the country. The 3 actually, as I speak to you, the money has actually gone to the various accounts units. So it is not true that they have not received the money. Maybe at the time we were talking to the communication team, they did not cross-check their facts before commenting on the same issue. So I believe that will be a miscommunication gap on the part of the communication team. We have actually sent the money.
In a related development, some nurses at the hospital are worried over delays in the payment of their salary arrears. The Controller and Accountant General's Department in October last year released a little over 700,000 Ghana cedis as payment for outstanding salary arrears owed some striking psychiatric nurses. 10 months after that monies were released, some psychiatric nurses are yet to receive their arrears. Agnes McDogby is one of the affected nurses.
Some of my colleagues have been paid, but mine and some are not yet in. Basically, they pick them at random. That is how it happens. So my forms wasn't picked. Until date, it has not been paid. Another form came in that we should fill it and then they'll start processing it. That was around in October. We did the same thing and then send it to them. Yet so the money is not yet in. They are supposed to pay my 9 months. Basically, it's very difficult. You know, living in Accra here is very, very difficult because the hospital is not providing you with any transportation, accommodation. Everything depends on you. So with the money not coming in, it's not helping. You have to borrow money from banks, from your family, and we are of age. You can't go to your family for money and I want money to go to work, I want money to feed. It's not fair.
The Health Ministry PRO Tony Goodman, however, says government is doing everything possible to make sure the outstanding arrears are paid.
You submit the supporting document to your account session. It goes to the agency. The agency will bring it to Ministry of Health, who will send to Finance. Finance take the same to Ministry of Auditor General. Auditor General will finish, submit it back to Finance. Finance will submit it back to us, and then we will now inform the institution. So you can see clearly that it's not 2 or 4 days or 1 month issue. And clearly, you are not dealing with 4 or 5 people. thousands of names because you are dealing with promotion, you are dealing with new entrants as well. So that will happen. It's not as if somebody is working and is not being paid anyway. But let me use this opportunity to also appeal to any body who actually has suffered anything because he or she has not been paid these arrears, that we are working to make sure that this arrears is paid. We're just waiting for the various institutions to finish their auditing process and verification and submit the document for us to pay.
Maxwell Agbagba reporting for Joy News.
And the partnership between the Japan International Corporation, that's JICA, and the Upper West Directorate of the Ghana Health Service will come to an end next month. The 10-year partnership saw the government of Ghana and JICA construct over 100 community-based planning, health and services compounds and went ahead to provide standard medical equipment to all the compounds. Now, acting Upper West Region Director of the Ghana Health Service, Dr. Winfred Ofosu, at the final dissemination forum on the Ghana Health Service JICA project stated that the construction and provision of the CHIPS compounds have led to the reduction in neonatal mortality rate from 11.2% per 1,000 live births in 2011 to 7.4% per 1,000 live births in 2015. Rafiq Salam has more.
Ghana Health Services in 2006 adopted the Community Health Planning and Services CHIPS compounds concept by the Japan International Cooperation Agency, JICA, as a national strategy for promoting accessible, quality and equitable services to all Ghanaians, particularly those in rural areas. JICA provided a total of $4.8 million for the first phase of the program, which started in 2006 and ended in 2010. Even though a lot of progress was made in the first phase, JICA and the government of Ghana believe that there was still room for improvement. The second phase of the program started with the construction of more CHIPS compounds and the provision of standard equipment for all the constructed compounds. Acting Upper West Regional Director of the Ghana Health Service, Dr. Winfred Ofosu, touted the achievement of the program, which is slated to end next month.
The regional institutional maternal mortality ratio declined from 212 per 100,000 live births in 2010 to 155.8 per 100,000 live births in 2015. As at the end of June 2016, it has declined further to 105 per 100,000 live births. Similarly, the regional institutional neonatal mortality rate declined from 11.2 per 1,000 live births in 2011 to 7.4 per 1,000 live births in 2015. Stillbirth rate also declined from 25.3 per 100,000 live births in 2010 to 15.8 per 1,000 live births in 2015.
Upper West Regional Minister Amin Amidu Suleimani thanked the people of Japan for the many interventions in the region, especially in the area of healthcare delivery.
Government on this part will continue to prioritize healthcare, especially in our rural areas where access to health facility is difficult. I know as stakeholders, before this forum comes to an end, you would have learned some lessons and good practices that will inform you on how to improve upon health care delivery in your various communities.
A representative of JICA, Masanori Yamazaki, was pleased with the 10-year stint of their work in the Upper West region and hope the region will continue to build and share its experiences with the rest of the country towards the attainment of universal health service delivery. Reporting for Joy News, Rafiq Salam. Wow.
You're watching News Desk here on your Joy Shalom Multi TV. Also available on your Go TV channel 144 and your DSTV channel 421. We return shortly to tell you some more, including an interesting thing that is developing. A private citizen is suing the president. In fact, he's placing an injunction on the processes that make it permissible, if I should use that word, for the president to invoke powers available to him according to Article 72 of the 1992 Constitution.